Good afternoon, everyone. We're going to get started in just a couple minutes. I want to thank you all for being here. Nama, thank you for joining us, especially on the holiday. I wish it was under better circumstances.
What a pretty room you're in, Nama.
Thank you. I've had time to decorate it.
Yeah. Okay, we're live. I'm just admitting a few more people.
Barb, do you see Chris, Carusi, and Maya?
Not yet. Those are the two I'm looking for.
Better turn off my radio. Sorry about that.
Dr. Friedrichs, thanks for joining us. I know that you have to leave early here, but thanks for joining us earlier. And then also thanks for joining us right now.
No worries.
Welcome, Ms. Carusi. She made it. Wait, no, Ms. Pearson, you said?
Right. Still waiting for her, Dr. Jenkins. I will text her.
Okay. I was just about to say Ms. Gomez-Smith. I didn't see her, but there she goes.
Dr. Friedrich, can you let me know how long you'll be able to be with us this morning or this afternoon?
Why don't we say 20 to 30 minutes?
All right, that's really helpful. And board members, I guess I would ask that if you have questions specific to Dr. Friedrich, that we move through those questions early on, and then come back to the rest of the conversation.
And then in that regard, I can say that, so I'm a virologist. I am not a medical doctor. And so I can talk about the science of COVID and Omicron and things like that, and things that make us think about, the science around our recommendations, but I'm less qualified to talk about, mental health, clinical manifestations, things like that.
Thank you so much for that clarification.
That's why we have a well-balanced team with you and Dr. Demiri, Dr. Wall, and Dr. Henderson.
Dr. Jenkins, are the district's own child psychologists available to this conversation this morning or this afternoon?
No, we did not invite. That would have been really a good thing. I'll think about that as we move forward. Let me just text someone and just see.
Thank you so much.
President Moldo, are you waiting to call the meeting to order?
I was, but I'm going to call the meeting to order. Thank you so much, Board Member Morelli, for checking in. I'm going to call this meeting of the Board of Education to order. We are meeting today for the purposes of talking about the delayed return from winter break, as well as the recent surge in COVID cases in our immediate community and the implications that has for our ability to staff our schools safely. I want to thank all of you for being here during the holiday. I know how difficult the decisions that this board has been asked to make during this pandemic are, and I want to thank Dr. Jenkins for our leadership and our medical experts for joining us. With that said, I'll turn it over to Dr. Jenkins.
Out of respect for time for Dr. Friedrich. I would just like to say thanks everybody being here, but I want to turn it over and then I can come back and I'll speak to anything that's on hand for me. But I have to say thank you to Nama. I just can't believe it. Outstanding having a student here with us during this time. Thank you, Nama. So any questions for Dr. Friedrich? He has approximately about 25 minutes.
Board Member Castro.
Thank you. Yeah, I do have a few questions for you, Dr. Friedrich. What do we know about the effectiveness of vaccines on the new strains we're seeing? I know personally, I'm seeing more breakthrough cases.
Yeah, that's a really good question, and one that we've really paid a lot of attention to in the last month since Omicron first was described. I think, unfortunately, the answer to that is a little bit complicated, so bear with me. And that really means, like, what are you asking the vaccine to do? So if you're asking, will the vaccine protect you against any infection at all, then it seems like vaccine effectiveness, especially for people who do not have a booster, is pretty low. So that means that if you have 2 doses of an mRNA vaccine or 1 dose of the Johnson & Johnson, you are relatively susceptible to getting infected by the Omicron variant. That's the bad news. And that also means that somebody who could be vaccinated and get infected, one of those breakthrough cases, they could be in a position to transmit the virus to other people. So we did a study at UW earlier in the summer when the Delta variant was predominant, and showed that among people who happened to get breakthrough infections, they could have a high amount of virus in their nasal passages, meaning they could also transmit to other people. So if you happen to get one of those breakthrough infections, then you could be a source of infection to others. The good news, however, is that first, vaccination, even if it's just 2 doses of an mRNA vaccine or 1 dose of the Johnson & Johnson, does seem to provide really good protection against severe disease. So severe disease means something that would cause you to be admitted to the hospital. So you can still feel pretty lousy and not have what is officially a severe case. But the protection is pretty robust against severe disease, and that protection gets even better if you have a booster. So that's kind of the state of things with Omicron now.
Thank you. About 3 more questions. What do we know about long COVID and its impact on young people in particular?
Well, unfortunately, I'm not the best qualified to talk about long COVID because it hasn't been something that I've studied or followed closely. Certainly, I know that people of all age groups are susceptible to long COVID, and there have been documented cases of long COVID among young people. But I certainly can't, I don't know that anyone's in a position to say what the emergence of the Omicron variant might mean for long COVID in particular.
Got it. Thank you. And given your time constraints, I will refrain from other questions for now.
Thank you so much, Board Member Castro. Board Member Vandermeulen.
Yes, I appreciate Dr. Friedrich, your time here today. Just have one question, and that is, do you believe that a 10-day pause is significant to be able to reset so that way we can keep open? Can you answer that?
Well, I think that unfortunately, the answer to that depends a lot more on human and district factors than it does on virological factors. What I can comment on about in terms of the virus is that we do expect cases to continue to increase in our community as they've done everywhere where Omicron has emerged. And that really goes back to what I was saying before about how the virus can infect people who are vaccinated. So even though we have a very high uptake of vaccine in Dane County, and among students and staff in the district, people can still become infected. And so the real impact there is, on the need to isolate once you are infected. And so the questions are about, if we're expecting a big wave of infections, even if a lot of people are going to be protected from severe disease by vaccination, what does that mean about the availability of staff and things like that? And that gets outside of my area to comment on.
Thank you, Board
Thank you.
Member Millen. Do you have any further questions? Okay. Board Member Gomez Schmidt.
Thanks. And thanks, Dr. Friedrich, for being here with us today and at the press conference earlier today. I just wanted to follow up on a few comments from yourself and some of our medical advisors during the press conference that based on our data and what we've seen, I just want to clarify that we have not seen a lot of spread of COVID in our schools up to this point, both based on our internal data and then based on our participation with the ABC Collaborative. One of the things that you have said a few times is that then that sort of means that our schools are safer for our students and preventing the spread of COVID than necessarily being out in the community. Can you sort of explain that again?
Sure. I think that that's a really important point, and I appreciate the question. The key thing there is that, the people are likely to engage in riskier activities, so ones that make them more susceptible to getting the virus when they let their guard down at home or gathering with friends or, doing activities outside of school. Whereas in school, I think there's a lot of incentives and there's sort of a strong structure in place to maintain those practices that we've known for most of the pandemic are going to reduce dramatically our risk of getting infected. And that stays true with Omicron, even though it is highly transmissible. So, being able to keep masks on throughout the day, being able to physically distance. And I think, very importantly, practices around lunchtime, where we can use practices that reduce the risk of spread through, unmasked activities like eating, make school very safe. And so, as we talked about in the press conference earlier, and as we've discussed in our metrics meetings, all the data that we have from the district suggests that there's actually relatively little transmission occurring in school itself. And people are much more likely to become infected outside of school when they're engaging in those activities where they're not as careful about masking and distancing and stuff.
Thanks. I just think that's a really important point for us to continue to highlight, because I feel like there is this narrative going on that the schools are what's spreading COVID, and we just see the levels in our schools are mirrored by what is in our community. And so the levels going up, and I just want to acknowledge the anxiety around this Omicron variant and the anxiety that people are feeling about going back to school, but also the anxiety about not going back to school, and the mental health issues that students are facing. And so I guess I just like to comment that I really do feel that we have to get our students back to in-person learning, and hope we can also, in addition to talking to Dr. Friedrich, have a discussion about that and about the plan going forward.
Board Member Carusi.
Thank you. Dr. Friedrich, thank you so much for joining us today. I know there's been a lot of talk about the importance of mitigation strategies, and I know because you're on our metrics team, you're familiar with the mitigation strategies we used through December to help keep kids and staff safe. As a virologist, would you recommend changes to mitigation strategies moving forward, particularly with Omicron in the community?
Well, overall, I think the mitigation strategies have been good. I mean, obviously, I'm part of the team that helps chart the course there. So I feel good about what we've done so far. I think that there are always ways to make to enhance even further what we might be doing. So as Dr. Jenkins mentioned earlier, I think making high quality masks available, more broadly available, is a great idea. But I want to, make that clear that even cloth masks have there's been a lot of bashing of cloth masks recently, and they have a role to play. There is sort of a hierarchy of efficiency and level of protection among masks, but the key really is that the mask should fit. And so if you don't, if it covers your nose, if it's tight against your face, even a cloth mask prevents like this cone of stuff that I am like spewing at my computer screen right now as I'm talking to you all, from going directly at a person that you're talking to. And so even cloth masks are an important barrier. And like the better a mask is, the better a barrier it becomes, both to a person who's infected, protecting others from them, and protecting others who are uninfected from exposure in the environment. So better masking would be fantastic. I would definitely maintain practices to reduce the potential spread of the virus during lunchtime, because I think that's probably your single most risky situation that most students are going to partake in during the day. So we've talked about that in those metrics meetings also. But it's really just to say again, like it's the ability to adhere to, like, stick with these practices in school that make school safer than a lot of other situations.
Just as a quick follow-up, could you talk a little bit about testing? Are we testing frequently enough at this point for Omicron? And I know that I think we have more flexibilities now to use rapid antigen tests and not have to follow up with PCR tests. I'm just trying to get a handle on, are we equipped to do the testing that is needed to go back safely?
Yeah, that's a great question, and I think that's something that will also go beyond the science too. So, scientifically, I would love to see testing be used more aggressively. I really would like to see testing as a gatekeeper to get out of isolation. So this is something that my colleagues and I have talked a lot about since the CDC revised their guidelines. There are still people who may be shedding infectious virus 5 days after an initial test positive. And it would be great to be able to test those people to verify that they're no longer shedding at that time. It would be great to test people before they gather, but it would be great to implement a sort of test to stay, which we've discussed in these meetings. So that's the idea that if you're exposed, you can take a rapid antigen test, and as long as that is negative, you may be able to stay in school and not have to quarantine. And so we do have the flexibility from a policy perspective, as I understand it, to entertain these ideas. But the problem is that they're extremely resource intensive, and the more testing you do, the more available tests you need, and the more staffing you need to be able to administer and then result back out those tests. And so those are things that just go beyond the science. That it's easy for me to sit here in my lab and say, like, you guys should test all the time, but actually, like, bringing that to practice in the real world is challenging.
Board Member Morelli and Board Member Vandermeulen, I want to acknowledge that I see your hand. And then I also want to put myself on the deck and make space for Nama to ask any questions she has before Dr. Friedrich is gone. Board Member Morelli.
Yeah, thank you so much, President Mulder, and thank you so much to all my colleagues that have been succinct and asked really great questions. And thank you so much, Dr. Friedrich, for joining us today. I wanted to expand a little bit on Board Member Caruso's question in regard to testing and efficacy of testing, and in particular, the timing of testing, which has been a little bit confusing. Can you speak to, like, symptoms get tested, how many days for the second test? And is there a difference between how do we apply tests for people that are not vaccinated, for people that only had 2 doses, and for people that had the 3 doses?
Yeah, these are all really great questions. And so what this boils down to bring it into my wheelhouse is really like how the virus grows once it gets in your body. And so the reason we care about testing is that for every viral infection, there's an early so-called incubation period. So the virus is in you somewhere, but it has to make a lot of copies of itself before you start to feel sick, and before you would test positive. And so there's a difference also in the sensitivity of different tests. So the PCR-based tests, where they take a swab and have to send it to a lab and you get results later, those are very sensitive. So they can detect even very small amounts of virus. And that means that they're able to detect that you're positive a little bit earlier in infection. So there's this time where the amount of virus is kind of ramping up in your body. And the PCR sensitive test can catch that earlier. The rapid tests need to have more virus present before they turn positive. And because that ramp up phase can be super fast, so you can go from a little amount of virus to a lot of virus in hours, perhaps. We've had cases that we've studied in our own lab where someone took a rapid test in the morning, was negative, went into a meeting with a bunch of people, even though they were wearing masks. They were like drinking water in this meeting, and that person infected other people in the meeting because they turned positive over the course of the day. And so this is why people have really been saying, if you're going to use the rapid test to decide whether you should get together with people, especially without masks on, it's really important to use that rapid test as soon as possible, as close as possible to the time that you're going to be together. So that's the timing element of that. And once you test positive in the rapid test, that means there's a lot of virus in your system. In most people who are infected, there's a lot of virus around for at least several days. This could start before they show symptoms. It could start around the same time that they develop symptoms. That depends on the person. And then once you develop symptoms, for a lot of people, by the time 5 days passes and your symptoms resolve, then you have a lot less virus around in your body. This is the basis of the CDC's revised recommendation, but some people will still test positive on those antigen tests. So all it is to say, I think you also mentioned that like if you're exposed, people recommend that you test twice. So in an ideal world, you might test, let's say, 3 days after a potential exposure. And if that's negative, that's good, but the amount of virus may still be kind of slowly ramping up in your body. And so the ideal recommendation would be to test again 5 days after exposure, just to make sure. So this is something that we've done with my own family. We got a rapid test before Christmas, and so all tested right before we were going to get together in a small group, and we're prepared to have someone go home if they tested positive. So this is how we've tried to use them ourselves. I'm aware that especially over-the-counter tests are very difficult to come by these days, and so that really constrains our ability to use these tests. We hope to see a much bigger supply of tests by the middle of January or something like that. That's what we're hearing from the federal government. They're trying to ramp up production. I really wish they would have done that before, but hopefully we'll have the ability to do much more aggressive testing in the not too distant future.
Yeah, thank you. And just to clarify for the public, your answer is across all the variants, right? We're not just speaking to one variant. There's very few differences that your answer is very general. And I have one more question.
Yeah, that's a great point. So really all those recommendations pretty much hold the same, whether you're vaccinated, not vaccinated, boosted, not boosted, whatever variant we're talking about, they sort of catch all of that.
Yeah, thank you. And my last question is around the quarantining time, which is, the CDC guidance was, I could not understand what you're trying to say. So if folks are testing positive but they've been vaccinated or got the booster, how is that, given that a lot of our teachers and a lot of our students are getting vaccinated, so that's the landscape that we're navigating. What is the recommendation for quarantining for after symptoms and symptoms with a positive?
So the CDC guidelines, as I understand it, are specifically about isolation, meaning if you test positive. So quarantine is like if you were exposed, but you don't know if you're infected. So right. For isolation, yeah, they're saying, yeah, and it's all these terms, I get confused. So with isolation, the recommendation is now that you can leave isolation 5 days after testing positive if you don't have symptoms. And so that's based on studies that suggest that most people, not all, but most people, if their symptoms go away and they're 5 days after testing positive, there's not so much virus left in their system anymore. They'd probably still test positive by sensitive PCR, but there might not be enough virus in their system for them to be infectious to other people. Some people at that day 5 time point still might be, which is why I'd really like to see a testing component to that. But I think the reality is that there just aren't enough tests for everyone to be able to do that right now.
So symptoms is a big driver for understanding how to navigate isolation.
Yeah. So that 5 day thing depends on an absence of symptoms. If you still have symptoms on day 5, then you're not allowed to leave isolation by those guidelines.
Thank you so much, Dr. Friedrich.
Dr. Frederick, I want to give Nama a chance to ask you any questions she might have. Nama, do you have any questions before
Sure, and
we?
I'll stick around a little bit too.
Thank you.
Yeah, no, but I just wanted to say I don't have any questions, but I just want to thank you for your time for coming. I think most of them have been answered, and I've been hearing around with what the CDC is saying and other news channels, so I don't think I have any for now, but thank you.
Okay.
So I have two questions. The Center for Disease Control has given folks a series of guidance over the course of the last, almost 2 years now. And some of that guidance feels like it's conflicting or outdated, including information around vaccines and masking at this point. I think we as a district want to encourage people to mask, not just at school, but throughout the community, and also to get vaccinated and boosted and to get their families vaccinated. Can you speak to how some of those guidelines have changed in terms of, folks who are vaccinated continuing to be masked?
Sure. So I think that that's a good point. And I think all of us feel a bit of whiplash, because like first we can wear our masks, like we have to wear them. And then if you're vaccinated, you don't have to. And now you do again, like what's up with that? And I think really what's up with that is two things. One, this is a virus that was unknown to science before 2 years ago, and we're still learning about it. And so, as we learn, scientists, like part of what we do is revise our knowledge. So as we get more information, we are going to change our understanding of how the virus works. And so sometimes, guidelines that are based on what we know, what we knew 6 months ago, just like we know more now, and we know that probably wasn't a good idea. And furthermore, as we've seen with the number of variants that have come around over, from Alpha to Omicron over the last 12 months, it was 12 months ago that we were dealing with the first variant of concern, which we now call Alpha. The virus itself changes as time goes on. And because the actual biological properties of the virus change, then we have to change our guidance to keep updated with that. So there was a period of time early in the summer before Delta was predominant in the United States when vaccinated people were pretty well protected even against any infection at all. Let alone severe infection. And so at that time, it kind of made sense, although I was afraid that this sort of question would happen. It kind of made sense for CDC to say maybe vaccinated people can take their masks off, because there's also a recognition that, we get tired of this. And can we get some benefit from having been vaccinated? But now with variants of concern that can infect even people who are vaccinated, even if those people, I'm going to repeat, are protected pretty well against severe disease, they can still get the virus and they can still pass it on to others who might not be vaccinated or who might be vulnerable because they're immune compromised or whatever. So for all those reasons, both to help protect ourselves and to protect the broader community, and let's also not forget, our healthcare workers who have been slogging through incredibly difficult times with a Delta wave and now an Omicron wave. Like we just can't afford to fill our hospitals. And so the masks need to come back on, even for vaccinated people.
I cannot thank you enough for speaking to that. Board Member Vandermeulen, I saw your hand. Board Member Castro, I saw your hand. Board Member Morelli, I see you after them.
Yes. This isn't for Dr. Friedrichs. This is in general. I worry that people are saying, well, it's not as bad or it won't put you in the hospital, this particular strain. What I worry about is the cavalier attitude on this disease. I worry about how it'll affect our students if we do not do a pause for the 10 days. And what I most worry about is our disabled students, our students who are Black and brown with disabilities, especially those who are nonverbal, who are most at risk. And I'm nervous because we're playing with their lives. And to me, that just is something that needed to be said.
Board Member Castro.
Thank you so much. Yeah. I just want to highlight that from the beginning of this pandemic, schools have not been put in ideal scenarios one bit, especially lately. The lack of a national coordinated response has been very frustrating. Dr. Friedrich alluded to this earlier, but the national shortage of tests. Right now, the testing supply in the US, we have about 1 test per person for a month. And that's all we have in the US right now. And the amount of testing that we need to do, given how easy this new variant can spread, even amongst vaccinated individuals, even amongst boosted individuals, is very concerning. And the fact that we have such a lack of an ability to identify those cases puts us in a really tough predicament too. And then just because someone isn't hospitalized does not mean that they feel great or that they are healthy or that they are protected from long COVID either, especially people with respiratory issues. We've seen evidence of how COVID of all variants can literally change the structure of your lungs and how you breathe for the rest of your life. And so I just really appreciate the caution from the team that we're showing right now, especially given that, we are learning new things about this new variant every day, that we are returning from break now knowing that the 2 doses of the original vaccine do not protect you from getting infected with COVID. We have a lack of people with boosters, a lack of tests. I just really appreciate that we're taking this pause to think through this.
Board Member Morelli.
Yeah, thank you so much. I've been watching some recent news around what is the peak for Omicron and what is an expectation of a new variant. Can you speak to any of those things?
Sure. So I think, and I'd like to kind of address the points that were just brought up too about severity, because I also share a bit of concern about some cavalierness around, rumors that the Omicron variant may be less severe. So in terms of infections, we're seeing just very steeply rising case numbers in multiple places where Omicron is emerging. We do have a signal from one place, which is the Gauteng province in South Africa, where Johannesburg is, where the outbreak of Omicron was first really noticed in a big population. And their numbers are going down pretty dramatically. And so that they were high for maybe a month, and now they're decreasing. So there's some hope that once we hit a peak, we'll stay at very high levels. A lot of people will get infected, but maybe it won't last for very long. But that's only one place. The fundamentals there are different from what they are here. One of the most important things to remember about South Africa is that, according to a South African colleague, a lot of people there, like a majority of people, have pre-existing immunity because they've either been infected with COVID before or they've been vaccinated. And that's not as true in our population. So we can't count on that as a model for what will happen here. There is increasing scientific evidence, including a study that some UW colleagues contributed to that came out just earlier this week from animal models that says that maybe the Omicron virus actually is a bit less severe than previous variants, but that's very preliminary. So I want to acknowledge that evidence is out there. A week ago, I would have said, well, I'm not really sure. But I think we may find ultimately that that's true. However, that doesn't mean that Omicron is no big deal. And I think that one danger we've seen throughout the pandemic is like this sort of like temptation to think in very stark terms, like, okay, either we need to wear masks or nobody needs to wear masks, or the virus is super dangerous or it's no big deal at all. Whereas obviously there's the truth is a spectrum. And so while Omicron may be a little bit less severe than other viruses that have come before, it still puts people in the hospital. It still strains our healthcare system. It could still kill susceptible individuals. And so, we have vulnerable members of our MMSD community and our broader Dane County community. And I think we do have to also think about our own actions in regard to our most vulnerable friends and neighbors. So like that, we're trying to think about all of this as we learn more about Omicron. So when will the peak happen? Don't know. How long will it last? Don't know. But we're watching numbers continue to go up, and I think that they probably will for a while.
Yeah, thank you so much. And thank you for extending the time to be with us. There was just one question around a potential new variant. Is that following the cycle of COVID, hearing maybe some research around this is already a weaker variant than Delta. What is coming up from breakthrough research?
Well, this is viral evolution is what I study in my lab. And so based on my experience, I would say I would not bet against the virus. So I do not have any evidence that there is another new variant on the horizon today. I think that Omicron is going to be a dominant or the dominant variant for some time. But I also have no reason to believe that this is the last variant we're going to hear about. The direction of viral evolution, like you also hear people saying like, well, viruses, they always evolve to be less severe. That's not true. So we cannot assume that that if it holds true that Omicron is less severe, that is the beginning of a trend for SARS-CoV-2, the COVID virus in general, to be less severe in the future. It may become more severe in the future. It may become still less severe. We just don't know. But I do expect that the virus will continue to evolve, and we'll probably have to continue to adapt to that.
Thank you so much. This has been extremely helpful, and thank you, President Mulder, for hosting this meeting.
Board Member Gomez-Schmidt.
Thank you. I know, Dr. Friedrich, you have to go. And so my question is more towards our staff and our testing capacity with our COVID clinics. And so I don't know if you have to dash now, Dr. Friedrich, or if anybody else had any more questions specifically for Dr. Friedrich.
I will stay for that discussion for a bit.
Okay. My question, I guess this is for Dr. Astor and for Ms. Stampley. It's around our own testing capacity. We're hearing a lot about the shortage of rapid tests in the community and the inability of people to get tested. What are we seeing? Because we have testing clinics open this week for staff and for students. How is our actual testing capacity within MMSD doing right now?
Chris, that's a great question. I will just share that the testing capacity at this point is limited. I'm going to turn it to Carrie to go into a bit more detail to give the board a really realistic point of view of what to expect next week.
Thanks, Leah, and thanks, Chris, for the question. So unfortunately, we do have very limited capacity, not in regards to clinics and staff to be able to do the tests. It's the actual tests themselves that we are extremely short on, and that is purely a supply chain demand issue. It is not for our lack of trying to procure and obtain these tests. We're not able to obtain the testing through our supply chain. So early in the week, we realized that there was going to be a need, especially over the holiday weekend, that there wasn't a lot of testing sites open in our community. And so our testing partner really stepped up to the plate, and COVID Clinic expanded their testing from Monday through Wednesday to do Thursday through Sunday. They are experiencing high volumes and long wait times between 30 and 60 minutes for people to be able to get a test. And that is just purely due to the very high demand for testing and the lack of community test sites that are open and have available testing slots. For next week, we are planning to have some testing available at all of our school sites. At this time, the other issue that we're having with testing is COVID Clinic themselves and our partners that we partner with are also experiencing the same staffing issues. So it's kind of across the board. People are having issues with their staff that are testing positive and not able to work. And so at this time, as of yesterday, when we met with our partners, we feel like starting on Monday, we were going to open a couple new clinics, that we were going to be able to open up all of our COVID testing sites on Monday, so that we will be able to operate fully. I know that we are going to have to pivot and shift based on their staffing demands. And so that's going to just require us to be really responsive in our communication in case we have to shut down a site due to their staffing levels. Unfortunately, at this time, we only have 3,000 rapid antigen tests for next week. And so just to put that into context, it's not that many tests if we're doing that. So we have that, and we have access to that, and we will have some rapid antigen tests available at our schools that don't have COVID clinic. We also have, I believe, our testing partners have access to 7,000 PCR tests as well. So there will not be enough tests for the demand for next week.
And I understand, I mean, our desire would be to switch to rapid and have that as another tool in our toolbox, because we have been doing a really good job with our partnership with the Department of Health Services and COVID Clinic. I mean, we have had challenges with it, but have been able to do the testing and the protocols that we need to do to prevent the spread in our schools. And so I guess my question, I know I understand the shortage of the rapid antigen tests, but is that 7,000 PCR tests, is that a normal, what we would have available, what we did earlier in the fall, or is that also limited?
I don't have those numbers, Chris, to really compare what we had available. I think what I can say is, due to the level of increased demand, like that will not be enough tests. And it's not, obviously not enough tests. If we wanted, we obviously would love to test all of our staff and students and ask everyone to go get tested. And so we don't have the capacity to be able to do that on our testing sites. And so really just encouraging people that are showing symptoms or had a known exposure, recommending that they get tested 5 to 7 days after that exposure. But our capacity, and then, with the PCR, it's all great, but there is going to be downstream consequences to that, right? So we rely heavily on Exact Sciences to be able to run those tests. And so I am expecting that Exact Sciences, like everyone else, is going to have staffing shortages. And I'm not sure that they are going to be able to meet the demand for testing in our community as well. So everything kind of has a downstream effect. So I am expecting that we will be seeing delays in our PCR resulting because of that as well. And so we're really just in an unfortunate time right now in regards to our testing.
Yeah, thank you. I get that. That is the challenge, is how this is all interconnected and how one thing sort of causes a ripple effect for other things. But I do want to make it clear that we do have these protocols in place and have had them in place since the beginning of the school year, as far as making sure that we are screening students and staff who may have symptoms or may have been exposed, and the contact tracing we've been doing. And we have tools in our toolbox to continue to deal with this.
Board Member Castro.
Thank you so much for highlighting the situation on our testing capacity. And I'll say this, as an individual board member, a part of this body, partially responsible for the employees, the teachers and school staff members in MMSD, I am not interested in sending anyone back to school if they think they have COVID. I think that would be remarkably irresponsible of this board. And I think given our testing capacity right now, listening to those numbers, we've got about a test for everyone for about a week or so. We aren't 5 days after Christmas. Well, we're 6 days after Christmas when people should be getting tested right now. And then the lack of the rapid tests, having to wait 48 to 72 hours for another result. We are in an unfortunate predicament that, I think speaks to the lack of people prioritizing education in our society. And I am very sad and frustrated by that, but we've been forced to act in isolation. And that's really disappointing.
I want to speak directly to our staff and our team. First of all, I want to thank everybody for working over the holiday. I can't imagine how stressful this week has been for so many of you. I want to thank our principals who have gone above and beyond to make us aware of gaps in staffing that would make next week really challenging to navigate if we were unaware. So I think that's an important thing to recognize. We are anticipating that the steps we're taking right now and the steps we're taking next week will allow for us to return to school on January 10th next, in a couple Mondays. What are the primary indicators in terms of, responsibly and safely staffing our schools that we will use to assure the community that we can open safely and bring our kids back to school? And then also, when we're talking about the different risks that we are weighing, we have to acknowledge the mental health impact that this has had. The anxiety folks are experiencing around this shift is palpable, and it is not something that any of us can take for granted or dismiss. I think people are really concerned about what this means for their kids, for their mental health, for their growth, for their education. So if you could speak to that, Dr. Jenkins, and then invite our mental health experts or our team responsible for that work to speak as well, I would greatly appreciate it. And Board Member Vandermeulen, I see your hand.
First of all, Chair Mulder, thank you for acknowledging the staff being here, and they have been working over the break, and I really hate that. And I know, but as a team, we know our responsibility, and we're trying to be very responsible, and we appreciate you having this meeting today so we can speak directly to the board. And thank everyone for the press conference, and we've been getting various comments in the support. Dr. Friedrich being here along with our other medical advisors, we really appreciate it. And if Dr. Demiria was here, I won't speak for him, but I would say he has been a champion in the area for us in terms of the socio-emotional mental health piece. And every one of our metrics meetings starting it out, he brings that lens along with Dr. Walls and also Dr. Henderson. But today we have Dr. Esser here with her team, and we also have our own psychologist who just joined us. And if Dr. Esser, if you want to take it from that piece first, before I chime back in terms of some of the preparation, things we've been doing since the beginning of the year, but now taking another closer look at students and staff, social, emotional, and mental health awareness.
Yeah, thank you. And thank you for inviting Dr. Kristen Getchow to the space. Kristen is our coordinator of mental health in the Office of Student and Staff Supports, and she herself is a former school psychologist and serves in this role. I will just start from a high level, and then I'll let Kristen jump in and share any additional thoughts she may have. We recognize that we are balancing two very precarious student needs: physical safety and social, emotional, and mental health. And we take that responsibility very seriously. We also recognize that we are supporting the social, emotional needs and the mental health needs of adults in our school and our school communities, and we take that responsibility very seriously. Our team has built out resources, tools, modules for our schools to use and have shared those in the past. Our team of teacher leaders return on Monday morning, and we will be pulling them together to further expound and add to those resources in response to the closing of school. So we will have those universally available for our principals to use. Additionally, we'll have resources and modules for principals and their staff to use to really tend to adult needs and adult feelings. This is a big deal for all of us, and we're all experiencing big emotions right now. Finally, just wanted to mention that my team is ready and prepared to support from a universal level and school systems, but also from an individual school perspective, individual student perspective, and supporting problem solving or overall student support planning. I'll let Dr. Getchow share just a little bit about what we have been seeing in our schools this year and how we will continue to ensure there's continuity and supports, particularly for our most impacted students as we move into this short phase of pause and virtual. Dr. Getchow?
Thank you, and thank you for the invitation. I think that, I have a couple of thoughts that I want to bring forward. One is what's become clear, what I've always known, but has become clear to me is that, all the challenge that's happening in community, healing also happens in community. So, our students take our cues from us as adults. And I know that just, myself and my friends this last couple of days, there's a lot of anxiety that's out there wondering what's going to happen. We know that the best way to manage some of that anxiety in a time of uncertainty is clear communication. So the work that you all are doing today to share information with our students and with community is definitely goes a long way, so that we all know that we're in this together and we're going to be taking the next steps together. Those pieces make a difference for the adults in our community, and they also make a difference for our students. Besides the work that Leah has offered, really we recognize that the other part about this being in community is that we really have to take a universal approach. So whatever we can do to create safe, supportive relationships, individual relationships and relationships within the universal structures and supports that we have for our students, whether they're in a classroom or on virtual or other connections that we know our staff make with our students and families, those are all the more important. And we have incredibly talented student services professionals that are doing that work every day. So our school psychologists, our school social workers, our counselors, our nurses, every interaction that they're having with students and families is part of us figuring out how to move through this together. And then, we also know that there's going to be students and families that are going to need something more, right? So we're offering the universal supports, but then we also have mechanisms in place for we're doing some universal screening at some of our grade levels, and also offering continued groups, referrals to supports within schools and out in the community. We're launching our Care Solace pilot that we talked about at the board meeting a month ago. And that's really all of our student services professionals are being trained in that this week. And then we'll work to get those links out to the community for families as well, to reach out to that resource, to be navigating mental health systems that are needed, mental health supports that are needed outside of school. And I feel like there was one other step. I think the other part, just to highlight what I'm hearing from other places, is that, all of the physical health strategies do affect mental health in multiple ways, right? Our student service professionals are stretched very thin right now covering lunches, right? Like there's just some reality of people needing to, in order to create the physical safety that's needed. We definitely feel that when every single person in that building is being out there to support the physical and mental health needs of our students. So we have a lot of great staff. I couldn't be prouder of the work that our staff does every single day. And they're stretched thin to meet the needs of our students as a whole child right now, and as our teachers are and everyone else that's doing this work on a day-to-day basis. Yep. I'm not sure if that answered your questions, but we do have a lot of plans out there, and there's a lot of, I'm incredibly proud of the group of people that are doing that work on every day. So.
Thank you so much for speaking to that. I think my follow-up question, and I guess this is something I'd like to say not only to our team, but also to our board, is to really consider the long-term implications of the decisions we're making right now. We're going to be moving into a conversation about our budget to a greater extent, a conversation about ESSER 3. And the reality is that we have to recover from this moment and the moments that have informed it. And so I am so grateful for the folks in our buildings and across our district who are working to support the mental health needs of our young people. And I also think it's an area in which we owe it to our community to be deeply invested in the long term. So thank you so much for your work. Dr. Jenkins, I think you wanted to add on to that. And then Board Member Morelli, I recognize your hand is up, and Board Member Vandermeulen, I think you've been waiting for a little bit to speak.
Yes, and once more, just so important that we have this conversation today. And you heard from both Dr. Gerchow. Thank you so much for being here today. We called a back on duty, on break, and you heard her mention about her own anxieties and mental health, and she's our go-to person. But I want to say that everybody's stressed in, everybody's being used at all time, and we know it's been an incredible pace that we came back to school in the middle of a dual pandemic. One of the things that we haven't lifted, one of the reporters asked about our most families who are most vulnerable, our children who are most vulnerable. They're impacted, and we've been feeling the impact of that since the beginning of the school, of having shut completely down. This is why we want to do everything and be proactive in getting back, because we know the strain socio-emotionally, the mental health piece is very serious. If we pause now, everything that Dr. Friedrich has said has just been like spot on, because he's been a part of our advisory, but this is what we're listening to. But the level of experts we have in our buildings, I have been, and we have been to all the schools. If you see it in the faces, the strain on the staff, on the students, and if you're just talking to them, this is pretty tough. And I commend all of them, because we have a whole lot of people who are doing the right things, but we have to take precautionary measures to make sure that the social, emotional, and mental health wellness is there for our students and for our staff. So do know, as we're paying attention to the science, we're also paying attention to the social, emotional, and mental health wellness of everyone. And I just really appreciate the opportunity to be before you and present where we are. It's a health side, and then it's also the whole social justice piece. We know that people have continued to, with the trauma and coming back to school and trying to address that as well. Our staff need help, our students need help, our parents need help. So this next pause that we're hoping to do over the next week is going to be for everyone's benefit at the end of the day. Thank you.
Thank you for speaking to that, Dr. Jenkins. Board Member Vandermeulen.
I have a couple questions on how our plan is. One, can we please get a copy of it at some point? And again, that is the least priority, because getting it done is the most priority. Number two question is that I get a lot of email. Will staff be able, if they have a young child, to take the child with them to work? How is that going to work? The number two question. And the number three that I've gotten the most in email, is there going to be like a Facebook Live for reopening on January 10th? Those are the three questions I hear the most. The other thing is a comment. I want to thank you guys for meeting during a pandemic. I want to thank you for taking this seriously and making it a actually inclusive personal decision. I know I can be a little overbearing on certain things, but the disability community has really been hit hard by the pandemic, and school is oftentimes a safe place for us. So I agree that we need to take a pause, because I'm afraid otherwise we'll end up being virtual all year. That's the last thing we want. So I just want to thank you and then call the question so we could please vote.
There's no motion to vote on currently, Board Member Vandermeulen, but I appreciate that you maybe are just symboling that we might want to lean towards wrapping up, because we could have this conversation for a really long time. And I will take that suggestion to heart. I see two more board members with their hands raised, three. So Board Member Morelli, and then Board Member Gomez-Schmidt, and then Board Member Carusi.
Yeah, thank you so much, President Muldrow, and thank you for lifting up our staff and our team. There are close to 30 folks in this call on working on the holidays. I know people have been nonstop with calls and meetings in preparation for where we are today and in preparation for next week. So thank you so much, deep gratitude. And also highlighting that we are also experiencing this, right? People are also with great levels of anxieties and navigating, making safe choices in their families, or navigating and getting exposure and testing and whatnot, and which makes this entire situation even more complicated. So thank you for lifting up the humanity that impact and how the pandemic is impacting all of us. My comment is in regards to how I understand that this meeting didn't allow for public comments. So wondering like what would look like community engagement moving forward, and in particular to hear from folks in regards to questions. I think this video has been extremely helpful, so I appreciate everyone asking really sharp questions that I think will really help our families. And what would look like for potential partnerships with the university and other partners in regards to masks, or in regards to additional supports that might be needed. How can the community, and we're super lucky in Madison that folks are already asking, like, how can the community support, and what are some of the venues that they can reach out for that support? Thank you.
Thank you so much, Board Member Morelli. Were you directing your question
Yeah,
at
I was-
members of the team?
Yeah, I was hoping, I don't know, Dr. Jenkins.
Yeah,
I was looking at you.
Yeah, I could definitely respond. I thought all the board members wanted to finish before I give those closing remarks on that. And first of all, to Board Member Vandermill, definitely heard those questions. And yes, we're going to go back Thursday. That's what we said in the letter, that we're going to give that announcement at that particular point. It'll be a letter. It's going to be multiple meetings, and we're going to talk about it as a team. And we're here to address that. And I'll get to some of your other questions yet, because I remember that was the last one, the childcare piece. We're working, and we've had Ms. Dyer working, and our Head Start people are out right now. They're hearing it just like everyone else is hearing it, but we're setting up to meet with them when they come back. I am going to work with Ms. Dyer along with the rest of our team to make sure we've learned from the first time around that it's very important to connect, which plays into Board Member Morelli's questions, with our community partners. So those individuals are going to bring them into the conversation and do this as we co-create what we need to do in terms of a proper response. I can't say enough for the mayor was on the phone right away offering support. Mr. Parisi, he and I with the county just offering support. United Way, Renee Mo is just always there for us. So many community partners have not been able to talk to UW or Madison College at this particular point as we're moving through, but as partners, we will be having additional conversation, and we're looking at some of our other nonprofits and individuals who want to support already, who have stepped up and said that they're willing to support us. We know that childcare piece is huge, and we know that providing food during this next week, and Mr. Hodo has been on that with his team, so we are there with that.
Thank you, Dr. Jenkins. Can you speak on, for public, particular families that have questions, what would be the best way for them to ask those questions? Is it the last talk? Is that emailing us? Well, given that the sensitivity and the time and, and all of that, what would be the best way for families to communicate with administration at this point?
I'll start with that. I'm going to turn to Dr. McGregor, but the Let's Talk has been our means of grabbing questions from our community. And Dr. McGregor, if you want to offer up the other things between you and Mr. Lamont, or how we want them to communicate with us, besides just with the building principles and all of that as well. We're just talking about from a district level.
Yes. From the district level, of course, we would love folks to go to the Let's Talk platform. It really allows us a very efficient way to route the questions to appropriate people to get the feedback and to track our progress. It even allows folks to give us a rating, good and bad, in terms of our response. We also will take the standard routes of email. We know that we get some building level emails as well, not just district, that then get routed to us, and we'll respond to those as well. And so we try to take a multi-phase approach, and we remain committed to doing that. But the Let's Talk, of course, that would be the preferred platform.
Yeah, and please reach out to your building leaders, because each building have their own nuance, and we would appreciate that too as well. Our building leaders have just been fantastic at reaching back out and also getting us the information.
Thank you so much, Board Member Gomez-Schmidt.
Thank you. And again, I'll echo the thanks for everyone who is on this call and everyone actually who has written in with their concerns. I'd just like to highlight the impact and the burden that this places on our families and our students to not have students returning to school. It is a huge concern. And again, the ripple effect that this causes in our community from parents who are working to just the expectation of the structure and the instruction that we provide for students. I guess one of the questions I have and what it has seemed to me, one of the primary drivers for this is our uncertainty around our staffing levels due to our staff being exposed or our staff, being sick with COVID. And we did get a staffing analysis today with some numbers. And I know that staffing has been an ongoing issue throughout this year, and it will continue to be an issue. Can we get an update on Monday or earlier, as soon as we have it, to know where we really are at for early in this week as far as our staffing levels? All of our staff are vaccinated coming back into this, and we are having staff in our buildings. So I'm hoping that with our screening, we can get a better sense of this right at the beginning of the week to know what we're dealing with. I guess it's a question for Ms. Carradine, I guess, as far as the staffing analysis and how we're going to go forward with that.
Let me just say before Ms. Carradine, Chris, and what you all asked for was the analysis, staffing analysis, and you're right, that's what I provided you with today.
Mm-hmm.
I'm going to step in and say, I can't have anybody working this weekend. I will work and do what I need to do, but everybody else is going to have to be off. I've stretched our staff, and I'm very afraid of what may happen if I continue to do that. But I'll continue to do what I need to do, but we would have it to you early next week. I can tell you that though, okay? And,
No, it doesn't, I'm not requesting that anybody works over the holiday or over the weekend. I'm just suggesting that as we go back into our schools on Monday,
right.
And our staff are back, that we really get an assessment by Tuesday or Wednesday as to where we are at with staffing levels. I think this is really important for knowing our capacity for getting our students back to in-person instruction.
Yeah, that's fair. That's let me say to you, that's fair. I will definitely make sure that we get that for you, and not to cut you off there, and you can finish your point. But I'll say I hear you, and we'll definitely have that. But it's going to be other factors too. We'll give to you. So I didn't mean to cut you off. Go ahead. I'm sorry.
Okay, no worries. And so I just, as we're looking at this again, and we continue to say that we're following the science, CDC, Department of Health Services, Madison Health, or Public Health, Madison, Dane County, like nobody is recommending that we close down schools. We have to find a way to navigate this as we go forward. And I agree with the uncertainty with having enough staff to safely staff our schools is a critical point. And so I do thank you for taking a look at this. I am concerned about, and I guess I would like to know what the metric is for deciding and coming back on January 10th. And that was asked a number of times earlier. And I know it's a number of different factors that are going to play into this, but I know it's the priority for everyone to get us back to in-person instruction.
Yeah, and just fairness too, I thank you for the question, but I believe it's our entire board, our entire team mission is to get us back to school and to stay in school. I answered the question during the interview. I've answered it previously, and I'll say it again. It's going to be multiple factors. As you know, the count rate is not necessarily what's going to be the leading indicator in isolation. It's multiple things. Dr. Friedrich followed up my response with his response to say, this thing is really evolving day by day, and we're going to listen to CDC. We're going to listen to public health. We're going to listen to our medical advisors, and you're part of the metric team. So you see how we go through that analysis as we're doing it. But I think right now, Tuesday, we're going to have the metrics meeting, which you'll be in attendance at that meeting. You'll hear that discussion. And then by then, we should have also more information after Thursday morning when the information is released from public health. And I think as we share it with all the board members in the community, and I think Nikki's question, board member Vandermeulen's question was good in terms of how we're going to share it out with the community. But everybody, I said it earlier, will have the clear metrics in which we're using to how we're going to go about making that decision. But right now, we feel like the pause is necessary so that we can get it back in school and stay in school.
All right, thank you.
Board Member Carusi.
Can I just make one more comment? Sorry, Board President Muldrow. Thank you. I guess I would just like to ask us as a board of 7 for us to consider, and maybe this is appropriate for February, that we really take a look at our decision-making role during the pandemic and how we are working in partnership with the superintendent to make decisions. Us as a board of 7 act voting on issues and holding public meetings. And so I really appreciate us holding this meeting today to give the public more information about our decision-making process. And I look forward to talking to you all about that in the future.
Thank you, Board Member Gomez-Schmidt. Board Member Carusi.
Thank you, Board Member Muldrow. Again, I want to echo the thanks to all the staff for all the work that has gone into preparing to return to school when it's appropriate. I don't even know where to start, except I will start with some sincere thanks to you, Dr. Jenkins, for reaching out to staff yesterday and meeting with MTI and having a good conversation with them that follows our collaborative planning goals and process. I think we're hearing loud and clear from staff that we need to support staff and we need to make sure that they know that they are safe and supported in our schools. And they've made many concrete requests around that. Part of that is making sure that we are able to compensate them for leave that they have to take during COVID. Part of that is ensuring that we have the PPE they need to feel safe. Part of that is ensuring that we have the testing that they need to be sure that they're safe in schools. We've also heard very clearly from staff that they are overworked and they need their planning time. And I think anything we can do to reduce meetings and professional development during planning time and let our staff use that planning time to reach out to families, to check on the mental health needs of our students and to check on students who might be slipping through the cracks, and to make up for the time that they are subbing instead of using their planning time, would help our staff be able to return to school in a way that respects their humanity and their time and their professionalism. I also think we really need to make a conscious move away from assessing children and putting staff time into assessing children and focus more on the social emotional needs of our schools as we move forward. I think this would help our staff immensely as we move into the next semester. That said, we also need to listen to scientists. We talk about listening to science a lot, and I'm kind of worried that that phrase is becoming a cliche. We say it so often. We have lots of great scientists who are reaching out to us, who are working with us on our metrics team. And I'm hearing almost unanimously from scientists that our schools with mitigation strategies and safe are safer for kids than the community. And I think that needs to be a foundational principle in all of our decision making moving forward. That is listening to the scientists right there. So I think we also need to be cautious as we talk about the data around COVID in our community to avoid hyperbole, because science is not about hyperbole. We've been talking about like week after week increases in case numbers, and actually that doesn't appear to be true. We've seen a spike this week, but other than this week, it looked like numbers were pretty steady, maybe some slight increases, and there was a bump down at one point, I think when some of the UW students started leaving. But we haven't had week after week increases that have, are looking catastrophic. We also need to be cautious about talking about the risk of hospitalization to children. While there are children in our hospitals in Dane County, they largely are not Dane County children. The last data available from Public Health Madison Dane County shows 5 hospitalized youth in the county. 3 of those youth were under the age of 12 and therefore probably less vaccinated and therefore more susceptible to COVID. I think we need to be cautious about, talking about dire consequences of reopening our schools, because that scares people when we don't have evidence at this point of dire consequences to having children in school. When we have good mitigation strategies in place in MMSD schools, and when we have good vaccination rates in our community relative to surrounding counties that are sending ill people to our hospitals. so that's all part of like listening to scientists and making sure we're grounded in science as we move forward with decisions. I know that, you know, one of the things we've actually heard from an epidemiologist who wrote to us and other scientists who've talked to us is that we have mitigation strategies in place, and we can put mitigation strategies in place to deal with COVID and have kids in person in schools. Mitigating the mental health consequences of the past year of virtual learning and going back to virtual learning is much, much harder, especially since if we are virtual, kids slip through the cracks, and the kids we need to reach the most probably aren't going to log on to Zoom and probably are going to be harder to reach. And I think we really need to consider the trade-offs of the significant and real mental health stresses on kids when we are not in the building versus the risks of COVID when we are in the building. And from what I'm hearing from the scientists we talk to, I'm far more worried about mitigating the mental health issues at this point if we can mitigate the COVID issues. And there are issues around staffing, there are issues around testing right now that we have to take seriously. But we need to take those mental health issues seriously. We also need to, like, you know, Chris Gomesh brought this up already, but the burden that going virtual is placing on our families is astronomical at this point. It's not slight. Many employers have like taken away the ability to work remotely from their employees. And so that leaves people in the position of having to say, do I quit my job or do I stay home with my kids because MMSD is going to be virtual? That's not going to be an issue if we're virtual for 3 days or even for a week probably. But if we end up being virtual for a long time, that's going to be real. And we need to absolutely prevent, I think, not shutting down, but going virtual as a district for a long period of time where the impact on workers in our district, and particularly people who work in hospitals and in medical settings and who are caring for all the people with COVID, like that burden is real and we've got to take it seriously. We've got to talk about it. Let's see, I agree with the data updates that Chris has asked for, in addition to understanding what's going on with staffing after a couple of days back. I think we also need to know when we're going to have a bigger supply of tests available. And we also need to know how we're doing on PPE. I know that we've ordered surgical masks, which is great. When are they going to arrive? Again, those mitigation strategies and having multiple layers of mitigation strategies keep people safe. And so I think the board needs to know where we're at with being able to implement those layered mitigation strategies is really important. Finally, in the press conference today, several times we talked about reopening Monday as something we're going to do, and other times we talked about reopening Monday as aspirational. And I'm actually very concerned about hearing reopening on Monday as an aspirational goal. I actually think that we need to be committed to reopening on Monday unless something happens where we can't because half our staff are out or it's not possible to open on Monday. But every day that we keep kids in virtual learning is a day when mental health issues are going to become worse for our students, is a day when students are more likely to disengage from school, and I think is a day that is going to lead to several more days of challenges when kids get back into buildings. So, as much as we need to make sure that everybody is safe and that we have the staffing and the PPE and the mitigation strategies in place to keep everybody safe, we also need to do everything in our power, I think, to get people back in person as soon as possible. And that's all I have to say. Thanks.
Board Member Vandermeulen, I'm going to ask that we hear from you. And then if Board Member Pearson wants to contribute to the conversation, we haven't heard from her and we've heard from other board members kind of multiple times at this point. So I want to make some space for Board Member Pearson before we end the meeting.
Yes. Just want to say a few things. One, when discussing that schools are not a babysitting service, and nor are they responsible for the ability on parents. Two, when you discuss individuals who may need to have, this is a burden on parents, how is it not a burden on the disabled for wishing to live? How is it not a burden when we've been called for asking it since the beginning to get basic mitigation strategies? I'm sorry, but I'm done being nice. I'm done being calm on this one. We are doing it because we don't have enough testing. Plain and simple, that is a federal problem that we are doing, and we are doing the best we can. But if we are going to determine whether or not someone is a burden, Well, guess what? I'm proud to be one.
Board Member Pearson.
Thank you. I've been, I take the approach most of the time at just listening and hearing what folks have to say, listening to the community, what they have to say. And the first thing I do want to say is that, thank you, Dr. Jenkins, and the entire staff. I think that having to balance this this decision with the realities of what we're going through as a city, state, and as a nation is not an easy task and not an easy thing to do. So I just want to say, first off, thank you so much for that. Speaking to some of what some of my colleagues have said on this call, I was one of those parents in 2020 who had to make the tough decision between working for the state and my children being virtual. So I understand that wholeheartedly, because I had to make the decision to leave my job to be able to have the luxury and availability to be able to work from home to have my kids at school. So I definitely don't think that anyone on this call is taking that decision lightly. As I've mentioned before, not in the public forum, but just in our briefings and such, is that this is a real thing for some of our families who, as some have mentioned, don't have the ability to have that flexibility. And it has also been stated multiple times, including in the press conference, that basically most of us agree on the simple fact that we must get back into schools as soon as possible for the social emotional aspect of our kids. So I don't think that that's the problem. I think what Nikki mentioned just before me is the problem. And, as a parent, as a community that, is dealing with COVID in a whole different way than many other communities are dealing with it, I think that it would be irresponsible for us to try to make it seem as though that we're not going to return to in-person and that we're only looking at virtual. And then also remembering that for some of our children, virtual is the best option. And that making that option available is for some of it's great. I also am a parent, and my kids are saddened to have to go to virtual, but they also understand that they also need to be safe, and their schools need to be safe, and they also want to be safe. So this idea that, and I'm trying to choose my words carefully here. I think at the end of the day, I think us working together and showing the community that we are in alignment, that we are working together as a unit, gives more transparency, but also trust with the community. And again, I want to echo what Board Member Morelli said about ensuring that we are looking at all the avenues of how the community can help us in this time too, and making sure that we seek support even in this 10-day period and extension, but also just what does it look like for us as a timeline in the future? As I mentioned before, what we have heard is that, this may take a couple more years. And so this may not be the only time that we are having to make this decision. And I think it's important for us to continue making the precedent that we will work with our community, work together as a board and administration, and trying to make the best option for our children, and that we're not just making some, random option or random decision that just is detrimental and no one knows about it, because that's not the case. And I think, again, kudos to the administration for having to make this difficult decision and also making sure that they work with us. Thank you, President Mildrow, for making sure that we had this area where we can share our concerns, but also that we can get more information about what's going on. This is not something that's simple. This is not light. It is a difficult decision. And I ask for the community to give us grace and to give yourself grace during this time, and to give our children grace, because yes, I understand. I have 3 little ones too. You know, I have friends who are teachers, and I have people who, you know, I care about who are in the schools, and we just have to give each other grace in this time. So those are just my comments that I just wanted to mention. Thank you all for posing the great questions. And yeah, I'll pass it back to you, President Meldrum.
Thank you so much, Board Member Pearson. I want to thank my fellow board members for their questions and their comments. I think that what I've asked you all to do today on New Year's Eve is to take this pandemic incredibly seriously without panicking people, is to, you know, help us promote accurate information throughout our community. And I want to thank my fellow board members who are committed to getting our students and our educators back to school in person safely. I believe if we execute the plan that we have created over the course of the last few days, that we will be able to return to school safely, that we'll be able to support our staff in doing so, and that we'll be able to do that on Monday, January 10th. So I ask of our community that folks reconsider their New Year's plans, that folks make sure that they're wearing a medically informed mask. I want to thank our HR for all the work that they're doing to make sure that our staff are supported in getting back to school in person. And I want to thank Dr. Jenkins for his leadership, as well as the entire team. We threw this meeting together really quickly. This is a variety of emergency meeting, and not a single person came forward and said, I can't do it, I won't do it, it's a holiday. People rose to the occasion of being here to support us as a team and support our community as we talk about what our students and our educators need. And I will remember that forever. Thank you all so much for being here. Dr. Jenkins, do you want to close us out? You're on mute.
President Moltro, thank you for your words, and thank you to all the board members. And we definitely heard all of your comments. And I just tell you, Dr. Gershel said it best in terms of, as our school psychologist, a real staff person who's in it, and she's there for everyone. I ask all of us and all of our community to remember our children will make it through this by watching us, how we respond. And when we respond, I ask that we are also very cautious in what we're saying, how we're saying it, and making sure we're being as accurate as possible. And I know for sure, as we continue to work together, we can get through this. This is Madison, and I'm proud to be a Madisonian. And I know we come together during tough times. What we're doing now is going to be setting precedent. We're going to take everybody through. It's not going to be the Madison of two halves like we know. It's going to be everybody. And every kid, every staff person will get through this safely. And we're trying to make sure, as many have said, that the social, emotional, mental health is intact as we do it. So, hey, I look forward to getting back with everyone next week and give the update next Thursday where we are, so that we can get back in school and stay in school. Excuse me there. I have to get that glass of water. All right. So thank you, President Moultrie, all of the board members, and all of the members of the team.
I will entertain a motion to adjourn. So moved by Board Member Pearson, second by Board Member Morelli. All those, Nama, your advisory vote. All those in favor, aye.
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 Motion carries 7-0. Thank you all so much for being here today. Happy New Year.
Thank you.
Happy New Year.